The following program is a production of Pioneer Public Television.
Hello and welcome to Compass, a production of Pioneer Public Television. I'm Les Heen, your host for Compass. It's a weekly discussion of public policy and important issues facing our viewing area. This week, we'll look at public transportation in rural Minnesota, including a look at how that transportation system is changing to meet some new demands. First, we have the story of how one rural service, Prairie 5, is working to improve its reach and availability for western Minnesota communities. For more on Prairie 5's efforts, here's a report from Laura K. Prosser.
For rural residents, public transit isn't as easy as walking down the street to the bus station or hailing a taxi cab. It's easier, with Prairie 5 rides picking them right up at their doorstep. The 5-county transit service has become a template for rural public transportation that has its heart in the community. Here's their story.
So Prairie 5 Community Action Council is a nonprofit organization. We provide multiple services throughout the 5 counties that we serve, which is where Prairie 5 got its name from. So back in the 80s, the state and Prairie 5 saw a need for public transportation within communities. There was a big push for heartland services by the state, and Prairie 5 was approached to start up a volunteer driver program. We started that program with, I think it was somewhere around $30,000 block grant that they got, and from there they've extended it into public transportation. So creating the public transportation is something that is very difficult just because you have to figure out what the need is within the community.
Prairie 5 has guidelines it has to meet in order to keep their funding. One of those guidelines states that they have to have 3 to 4 riders per hour. To meet those standards, the business needs the help of volunteers.
Right now we have 6 cities that we operate buses in, so it has to be a resident that lives within the 5 counties or is coming to the 5 counties of Big Stone, Chippewa, Lackaparra, Swift, and Yellow Medicine. So with our volunteer drivers, that allows us to go into like North and South Dakota and throughout the state of Minnesota. We go to Rochester, Twin Cities, we go to St. Cloud, we go to Willmar. And most of that is for like specialty clinics and stuff. To go to the Twin Cities, we give rides Monday, Wednesday, Friday if there's a need for that ride, and it was really convenient for the riders. So that's kind of why we did that. We're a demand response, so somebody calls, they need a ride. If we have the resources to do it and they live within the 5 counties, then we give them the rides wherever they want to go.
Rural transit still faces challenges, including funding possibly tapering off come 2020 due to the transportation bill. So Prairie 5 has had to get creative and become not just a bus fleet, but a community fleet complete with vans and volunteer drivers.
We started 7 years ago with, when I started as a program manager, we were doing about 50,000 rides, and now we're doing 140,000 rides. So we're doing a lot more rides than we have in the past. Our volunteer driver pool stays right around 30 to 35 volunteer drivers, and ultimately we could use as many as we could possibly get. The vans and the buses are really good as far as filling in the void for community transportation. But when it comes to those long rides to go to the Twin Cities to get to the specialist or go to Willmar or St. Cloud and stuff, that's where volunteer drivers really fill that void, kind of give that one-on-one personal service.
Rides vary in pricing from $1.50 round trip in town to punch cards that get the ride down to $1 a ride. Ride fares like these work to cover the match funding that the organization has to meet to get and continue their federal funding.
Also, there's a financial cost of maintaining it. The insurance cost of having the liability insurance and stuff like that is really expensive. And it's a match of 85% state federal money and 15% of it has to come from the locals. So those fares and the contracts and stuff that we have, make up that additional 15% that we need. Without the funding sources and without the community help, the dollars that we need to stay in operation would be very difficult. For us, a working relationship is very important. Without there being a need and without the people needing the service, we wouldn't be available, we wouldn't be around to provide those services. It kind of makes us kind of connected to the community and really just trying to give the service that's needed.
With us now to discuss rural public transportation, we have two guests. We have with us Bev Herfindahl. Bev is the Transit Project Manager with the Minnesota Department of Transportation, or MnDOT. And Darren Toso is from Fergus Falls, and he's with Fergus Falls Transit Alternatives. Bev, Darren, thanks for coming in.
All right, thanks for having us.
It's fascinating to see what happens in public transit because, of course, people talk about rural versus urban and how all things fit together. But I know both of you have some pretty big responsibilities. Bev, let's talk about what you do with MnDOT.
Well, I work with the state in the Office of Transit, and I am a project manager. I oversee budgets and service design that all of the transit systems put together in their annual application budget for funding. The funding that they receive is directed by the service design that they put into the plan as they put their budgets together. So the service design tells us what kind of funding they're going to need and how we can move forward with that.
Okay. And Darren, in Fergus Falls, it's not just Fergus Falls, but a larger area that you serve with public transit, right?
Right, we cover 3 counties in the area, Otter Tail County, Wilkin County, and Clay County. And the vast majority of the service is serving the communities themselves, such as Fergus Falls, Breckenridge, Moorhead a little bit, and then also Parkers Prairie and Perham. And so we cover a wide range of areas, and the ridership has really grown over the 10 years that we've been in service, and that's really been great to see that people are using the service a lot.
Sure, and I know when we had a discussion before the show started, one of the things that came up was the idea that what's interesting about rural public transit is that in many cases people don't use it until they need it, or they don't even know it's there, right?
They don't even know that it exists until they need it, and then they have a hard time trying to figure out who to call or where to go.
So where do people usually go to start? How do people often find public transit? Local agencies?
Local agencies. Generally, if they see a bus driving around in their community, there's a telephone number on it, and they will call the telephone number and get the information that they need. A lot of the other services that are available through the senior services or the family service agencies in each county generally know about what is available in their area for transit.
And in terms of what's available in an area, I mean, we're talking about nearly all of Minnesota. Nearly all of Minnesota has something, right?
Currently, there are only 3 counties that don't have a countywide transit system in their area, and they are in the south central part of the state. Everything in the western part of the state has public transit available to it.
And I suppose, Darren, one of the things that you find is that people may not understand that there's a responsiveness in a lot of public transit where it's not just a matter of being at a certain place for a bus, but there's actually flexibility in the scheduling, right?
Right, they just make a phone call to our dispatch office, and from there we can send the bus directly to wherever they are, right to their home, right to their place of business, wherever they need to go. It's curb-to-curb service, so we bring them exactly where they want to go.
So once they know about it, then they tend to find it or they call for it. But I think one of the changes people often know about services for the elderly or services for the disabled. But you also find that there are a number of other groups that people may not understand, right? That they're using it now?
A large portion of the users of public transit are preschool children or even people going to and from work. For whatever reason, the bus fits their needs, whether they currently don't have a license available, they're new Americans. a wide host of people have access to transit, use it to get to and from work. If you live in a college community, the colleges are generally helping support their students using the public transit buses, particularly in the colleges where they have students from outstate or other areas, other countries. A lot of other countries have more robust transit systems than we do. So they come to the colleges knowing full well that transit is something they should use. So it's very advantageous in those communities.
And as much as we've heard about employer issues with the workforce, this gets to be even more important because if people are shortage of workers, they really want to make sure the workers get there on time.
Right.
And so we're seeing a lot more of that as well. Volunteers, I also found it pretty interesting that you've got volunteers who play a role, right?
Yes. Having the buses, the small buses that you see driving around, we can never have enough of them, and volunteers have been a huge backbone to a number of transit systems. And in some cases, they are a part of the transit system being able to provide service. The volunteer is driving their own vehicle. They do the exact same thing that a transit bus would do. They get the call from the dispatcher. They go out, pick up, drop off, get people where they need to go. It provides a higher level of service than just having the buses available would do.
And Darren, I know you've been doing what you do for about 10 years now. What sort of changes are you seeing right now in terms of where we've been with rural public transit and where we're going?
Well, big change has been, like you guys had mentioned earlier, that we're seeing a lot of small children use the service. That's grown immensely in just the last couple of years for us especially. Just ridership in general is growing, and so there's more demand there. We don't cover a large portion of the real rural part of our counties because a lot of times we're just not able to provide that service because we can get a lot more ridership in the communities that we serve right now. And it's growing a lot. I think, like you had mentioned too, we also just need to keep getting the word out, let people know that we're there, because there's a lot of people, I mean, we've been in service for 10 years, and there's still a lot of people that don't even know that we're there or that they can use it. They think it's for the elderly and disabled.
But in many cases, you may have somebody who doesn't have a license or has never had a license, and they need to get from a town here to a town there, and they struggle to figure it out, not understanding that there may be a bus available, right?
Right.
Yeah, that's one of the things that I've noticed when I've been talking to people about transportation in many areas is that people may not understand what services are available. One of the other things, of course, that comes up is, people might be wondering, well, how does it get paid for? So, what's the funding like for public transit?
The funding for public transit comes from federal dollars and state dollars, and it is the federal dollars that we use for rural public transit are dedicated specifically for rural areas. The larger cities have their own funding source. It comes directly to those. The federal funding for rural transit comes to the state, and then the state will send it out to the locals through their contracting process. The state dollars come from the general fund and also the motor vehicle leased sales tax dollars. So when people lease a vehicle, there is a portion of those dollars that come toward supporting public transit also. And then there is also the local portion. And in most cases, the local portion for operating dollars is a 15% local share. So whatever the contract amount that MnDOT does the grant contract with the transit system for, 15% of that needs to come from the locals. And the local dollars can be fare box because people do pay a fare to use the service. Or if it's not adequate to meet the needs of the service, then some of the dollars are coming from the counties and the cities to help support it.
Sure, and I'm sure the fares can vary a great deal from area to area, but what would some typical fares sort of be? Is there a way we could describe that?
Well, for ours, we've kept them the same since the day we started. In our smaller communities, it's $1 a ride. And in Fergus Falls, it's $1.50 because it's a little wider range of a city. So it's very inexpensive, and I think we need to try to keep it as low as we can because a lot of times the people that are using our service don't have a lot of money to spend. That's why they're looking to use our bus and they may not have their own car.
Some of the transit systems may charge $2 for a ride in a city, but the trips between communities generally have a prorated structure to them. So many miles for $3, so many more for $4, and it's based on a local decision decided by their governing boards.
And one of the other things that comes in too is, I mean, over time you may add a route, you may change a route, you may get rid of a route, but it strikes me that would be fairly challenging, because if it's difficult for people to understand public transit is there for them, it also takes a while to make sure to even figure out if a route is successful, right?
It does. And when we start something new, we generally make sure that it goes for at least 6 months before we make any changes. It sounded like a great idea, and 6 months down the road, it is a great idea, and you keep doing it, or it needs tweaking because it needs to go to a different direction as compared to what we thought it was going. And those are all local decisions. A service design can get changed just by sending an email to the project manager saying, this is working, but we need to do it this way now. And then it gets incorporated into the new service.
And Darren, in Fergus Falls, I know you even see significant seasonal variations, right, in terms of who uses transit, winter versus summer, fall versus spring, those kinds of things, right?
Yeah, winter tends to be the most busy time for us. It is generally busy year-round, but summer it does slow down a little bit. You don't have the preschool kids then, although you do get a few kids going to summer activities. But winter is definitely the busiest time of the year, and it keeps you running in the winter, I'll tell you that. It keeps us running very busy all winter long.
So as you think about some of the demographic changes we've talked about in rural Minnesota, because of course we talked about the fact that we have an aging population, many counties have a shrinking population, and then we also have new populations moving in. How are the demographics changing rural areas? And Darren, I'd like to start with you first on this.
Well, like you said, I mean, they're definitely getting older. Communities are getting older where we're serving people, and
because you've got some people who may be a little bit older in one community, and there may be another part or another neighborhood where it's younger workers. So you'll see those kinds of shifts, I suppose, in where the service is, right? Just from people moving in and out. Right.
Perham's a little bit younger because they have a lot more industry there, and so there we're finding a lot more younger people using it. But in Fergus Falls and Breckenridge especially, there's a lot of elderly people there, and they've kept us busy, and that's the vast majority of them is still the elderly and the disabled, but.
And because I know I've even read about in some cases where there are communities where private employers have gone to the method of bringing buses of people into an area, and I don't know that a lot of places in rural Minnesota we've seen that, but you read about it in other parts of the country or in suburban areas. So isn't that another real thing about employers really saying, wow, I need a workforce and I'm ramping up for a new shift, and big things are happening, right?
Yes, and they will start looking at public transit for that, but a lot of times public transit isn't available for the extended hours that they may need for their second or third shift.
Work, yeah.
And so it's difficult for public transit to do some of those trips. Public transit is available if it fits into the needs that they have. One of the things that we are seeing, not so much with the demographics, but we are seeing that there is a need for extended hours of service. Certainly not to the middle of the night in rural Minnesota, but at least until 8 or 10 o'clock so that people can go shopping after they get done with work or taking a movie or that type of stuff. So we're seeing extended hours during the week, and then also some requests for Saturday and Sunday service.
I imagine if someone moves into a rural area and they spent their life in Chicago or New York or Minneapolis and they're used to a set period of public transport, the idea of demand response, let's just put that in quotes, demand response, that's a whole new concept for them, isn't it?
It is.
So what happens when you talk to people? No, we can figure this out. Tell me what that process is like.
Well, Darren might be better able to tell you that, but...
Actually, they're very surprised that if they can call us and that we're going to meet them right at their door. They're like, where's the bus stop? We don't have one. We're going to come to your door and pick you up. Where do you live? So it's a big surprise for them when they find those things out. But I was going to touch on another thing, too, with the demographics is with the people getting older is I think we're providing a service that is going to be able to keep people in their homes longer. And I think that's extremely important.
And one of the one of the challenges with the aging population is we are seeing a lot more need for the lifts on the buses. All of the buses are lift accessible in Minnesota, and a lot more lift use now compared to 5 years ago, because people have a disability and they can't make the stairs, so that they can use the lift to get onto the vehicle.
Sure. So we're seeing changes for what people are physically able to do, or they may have been using it without a lift, then they need a lift. The other thing, and of course, whenever people talk transportation in Minnesota, they always talk about funding, and you touched on this earlier, but is it sort of a challenge too, because you're seeing the needs growing like this, and yet you're always trying to figure out, okay, but we also need to make sure all the funding pieces work.
Right.
Right, and that's one thing that is starting to get difficult for some of the rural transit agencies. I'll just speak for us, I guess, but is with that 15% match and the fares being so low, we're lucky enough to have some contracts with cities and county and that type of thing, but it's getting tough to make that match, because as we do get more funding from MnDOT, we still have to increase our percentage. It goes up each year too, and so it's getting more difficult to make that match for some of us.
We are in the middle of updating our investment plan, and that is one of the things that we are very concerned about, because MnDOT does have dollars available to expand service, to expand the length of days and meet more needs in the rural area. But the challenge is that the local councils, commissioners don't have that ability, and so that is becoming difficult.
So is that also then leading to different sort of combinations or consolidations or coordination among different counties where they may have gone out on their own, or a city might have gone out on their own, they have to work more with other communities? Is that happening?
In some cases, it does come down to the dollar amount that they are having to put in at the local level. But in other cases, it is just a matter of all of the federal and the state requirements are becoming burdensome. And in our very small public transit systems, the bus driver may also be the person that does the computer work, and may also be the person that does the talk to the Kiwanis and the Rotary, and then has to take care of all of the federal and state requirements on top of that, and it is overwhelming. And so we're finding that we need to have people that are able to specifically specialize in a certain segment of a regulation, that they are the go-to person, and that helps eliminate some of the overwhelming burden.
Well, I also expect too that because of the traditional relationships between some communities, some partnerships would be more logical than others, right? Because if you've got this community and most of their health care comes from this community, or most of their schools, so I suppose there's sort of some logical groupings that are more likely to happen, right?
There are some logical groupings, but we're also finding that people need to travel further. In the 1980s, if you traveled 20 miles to do something, you were going a long distance. But in today's day and age, it is nothing to hop in your vehicle or catch a bus ride and go 50, 60 miles to go shopping, or to get your medical attention taken care of, or that type of stuff. And so we're finding that the coordination that we need to be developing is probably more critical than some of the connections, that whether it fits or not.
Yeah, I know, Darren, we kind of touched on this briefly, but Mike, in your case, you've got 3 entire counties that you have responsibility for, right?
Right, yeah. It's, like I mentioned earlier, it's Otter Tail, Wilkin, and Clay counties, and like you'd mentioned, it's nothing to hop on a bus and ride 50, 60 miles. We have 2 different routes that go from Fergus Falls. One goes from Fergus Falls to Fargo, and the other one goes from Detroit Lakes to Fargo.
And for people who aren't familiar with the area, give us a sense of what those distances are.
It's about 60 miles each way for that, and it's mostly for people going to work, that type of thing, but occasionally get some other people that want to do some shopping or medical and that type of stuff. But so I think it's just a very valuable service to get some of those people to work. Otherwise, they wouldn't have the employment that they do.
Yeah. As we go into the last 3 minutes of this, let's talk a bit about the future a bit, because we've talked about the fact that the demographics are changing, and you've got different people using the systems, and they're going to use the system, and funding is an interesting mix. What's the future of public transportation? And Darren, I want to start with you on this, because of course you've got a concentrated area that you're working on, large counties, but still a concentrated area. What do you think the future is for public transportation in your area?
That's a really good question. What I'd like to see is where we could cover the entire counties. That's one thing I'd really like to see happen, because there's a lot of people in the rural areas that need access. They need to get to their medical appointments, that type of thing.
So they may be in a town of 100 or 200 and they're in a far corner of the county, but right now it's not realistic to necessarily go there, right? That sort of thing?
Yeah, that's one thing I would like to see us try to get to that point. I don't know if it'll happen anytime real soon, but if we can take steps each year to try to increase the area that we can serve, I think that would be very beneficial for us.
And from what I've understand, this is just anecdotal, there seems to be a lot of interest in that. I mean, obviously people live in that community. They'd like you to be there, right?
Right, yeah. They'd like to stay in their homes. You know, that's where they live, that's where they want to stay. They don't want to have to move to Fergus Falls necessarily or to Breckenridge. They want to live in their small community or their farmhouse or wherever they've been for many years. Sure. And so we'd like to be able to assist them to do that.
Yeah. Bev?
We're looking at something along those lines, and it falls into the axis of lifeline service, something that twice a week, twice a month, however it fits into the needs of the community, that they would be able to at least access the public transit system. I live in Lac Pearl County. I live in Boyd. Well, I live outside of Boyd, but you know, you're right. That's a very small community, and those people need to, there is a small convenience store that they may be able to get milk and bread, but to get other services, they need to go.
They do, yeah. On that point, we have to close out. We're out of time, but I want to thank both of you. Bev Herfindahl from Minnesota Department of Transportation and Darren Toso from Fergus Falls Transit Alternatives. Thanks for joining us on Compass.
All right, thank you.
That's it for this week on Compass. Join us next week for more people, places, and issues facing our region. Thanks.